It's World Glaucoma Week, and the theme for this year's World Glaucoma Week celebration is "The World is Bright, Save Your Sight." We at Cypress Eye Center, we are adding our voice to that of the world to celebrate this year's Glaucoma Week. We want to educate us about glaucoma. Now, glaucoma is a group of eye diseases that affect the optic nerve of the eyes. The optic nerve sends information to the brain, which the brain interprets as the images or whatever we see. There are different causes and risk factors associated with glaucoma. The most important of all this is increased intraocular pressure. When the eye pressure is increased, it causes more pressure on the eyes, thus causing this damage we talk about on the optic nerve head, causing loss of vision, which starts from the periphery towards the central. Another risk factor is hereditary. It can be passed down from a parent to a child. A father that has glaucoma can pass it down to his child. Another one is people that have short sight. People that have short-sightedness, they are more prone to develop glaucoma. People that have thin cornea, will still show you the test where we can detect people that have thick or thin cornea, and so many others. Glaucoma can be caused by trauma, whether chemical or force or accident. Any trauma to the eye can cause glaucoma, and so many other causes. Walk with me into the clinic, so I will show you the different tests we carry out. So before we go into the introduction of the tests we carry out, I would like to remind us that in the early stages of glaucoma, it doesn't show any pains, it doesn't show any signs. So, which is why we encourage a regular eye examination for proper diagnosis and management. Now, this is the visual acuity test, where we check the patient's vision, how well the patient can see. Now, this is the ophthalmoscopy, where the doctor checks the patient's retina. The retina is at the back of the eyes, and that is where the optic nerve, this optic nerve we've been talking about, this is where it is located. The doctor is checking to know if there is any damage on this optic nerve or not. Okay, this is the pachymetry. This test is carried out on patients to determine when a patient's cornea is thick or when it's thin. A patient with a thin cornea is more prone to develop glaucoma. Now, this is the visual field test. This test is carried out to determine how wide a patient can see. When the optic nerve is being damaged because of this increased pressure, it goes to the outside, or what we call periphery. From the periphery, the nerves at the peripheral part of the retina is being damaged first, then it comes down towards the central. So this test determines how wide this patient can see and the extent of damage caused by the glaucoma. This is a tonometry test where the doctor checks the eye pressure, intraocular pressure of the patient. This pressure, like I talked about earlier, is very important. It's the most important factor for glaucoma. When the pressure is too high, it causes more pressure on the eye, thereby causing more damage on the optic nerve. Now we are done with the tests. I would like to leave you with few tips. One is regular eye checkup. Regular eye checkup is very essential for detection and early diagnosis of glaucoma. 2, always know your history, your ocular history, your other health history. Not just you, your family health history. Always follow your doctor's guideline on how to use your eye drops and other management options. 3. Don't self-medicate. Seek your doctor's opinion in whatever you are doing.
Visit us at Cypress Eye Center for proper diagnosis and management of every eye problem. We're located in Abuja. Number 4 Block 6 Abak Close, off Ibadan Street, Area 3 Garki.